When we're looking at special populations, we also have to consider the population of women and children. There's a very distinctive, there's a difference when you're working with the population of women versus men, obviously. But there's some more cultural competent issues that we must be aware of. And there's actually 16 that we've listed today, not all inclusive, but women are representing a growing percentage of drinkers today. I was reading an article last week, and they were showing that a huge population, the Latina population, the rates of heavy drinking are just becoming alarming. So women in general are representing a growing percentage of drinkers today. So some of the gender differences that I want to elaborate on today, again, it's not all inclusive, but one of them is that women can point out specific triggers and cues. Their disease appears later and progresses more rapidly. So they may enter treatment later on, but if they may end up developing alcoholism later, but yet it's rapid deterioration versus men. They're more susceptible to medical problems. They consume less alcohol, and the reason why they consume less alcohol is because of an enzyme called ADH or GADH. So they become intoxicated a lot faster than men. It has nothing to do with their weight, it has to do with the enzyme. They come into treatment earlier. There's a greater likelihood of divorce. Women are more likely to have a dependent, an alcohol or drug dependent partner. Economic burdens, they have greater economic burdens, and part of that is due to the fact that women alcoholics have fewer vocational skills and training to provide for themselves. In addition, they are more susceptible to depression, anxiety disorders. They may have recent episodes of violence, domestic violence, a fear of losing custody of their children, which is one of the common reasons why they stay in the relationship, is to not lose their custody of their children. More susceptible to HIV/AIDS. Suicide risk is higher with women than it is with men. Pregnancy. And last, family relationships are very strained. Many a times in a drug-dependent, alcohol-dependent relationship, it's quite dysfunctional, and there's an isolation or a withdrawal from the family core, the family unit. And so those family relationships are strained. Some of the treatment approaches that have proven to be effective with women and children is residential treatment that accommodates women and children, brief intervention, and support groups that are specifically designed, culturally designed to meet the needs of women.